We're going to be recording this. I'm not sure where we're going to upload it. Charles, are you going to have it at your website?
It'll be on YouTube, and it'll be linked to your website and to Charles' website.
Okay. So if you want, you can go back and rewatch that if you missed something, if you want to hear something again. If you want to tell your friends about it, there'll be some great information, I'm sure. Dr. Charles Lewis, we got a good seminar on brain health and cardiovascular health. I think this one is going to be a little bit different. I think Charles was telling me what we've done in the past. Not quite as specific, but looking at the body as a whole. So I'm excited for this one. I'm going to go ahead and give him the floor because I know we'll use up all the time. So thank you, Dr. Charles.
Well, thank you for coming. I'm going to try and make it through this next hour and a half without boring you. And I hope my voice makes it the whole time. I was telling Jake I took off my tights. Them, my red S tight. And when I did, this kryptonite out of the weeds, they're calling it pollen, attacked me when I had my suit off. How dare they? Well, anyway, I've got a throat lozenge. We'll see if we can get through this. As you all know, we moved down here, and our first day in this building to meet with people and in the back, and it was a year ago today. So that's kind of a neat little anniversary. Now, we haven't been here that whole time. It took us a long time. We moved here maybe just a few months ago. Finally found a nest. And I'm glad you're here. I know you had a lot of choices to go to tonight, but I'm going to try and make it worth your while. You've got a lot of take-homes, and I've got a little surprise for you at the end. You're going to like it. So don't go without, getting your little surprise. We are doing the summer series here at Nature's Way for you, and we've been talking about a variety of things, and we've been talking about it by narrowing in on that topic and talking almost like a specialist on that topic. Tonight, I said, why am I doing this? Tonight we're going to change it. I'm going to approach it like I do in my clinic setting, holistically, because not one thing is standing alone in your body as an issue. One thing affects everything, right? One thing can mess up everything, whether you stub your toe. And that's why they started functional medicine and have a whole different lab to send blood tests to, because all the blood test labs' ranges are based on blood tests from sick people the doctor sent in to get lab tests done. And so they say, well, they just have a blood sugar problem. So the lab says, oh, well, then we'll just use everything except blood sugar issues. Like it doesn't affect the rest of the body. It doesn't affect the neurological. Come on, it does, right? So why would having dysglycemia, whether you're high or low, isolate itself and say everything else is fine? It can't. So functional doctors got all the 85-year-olds that were playing volleyball on the Florida beaches and said, those are good candidates, let's get them blood tests. In other words, they took some healthy people, and by golly, ranges ended up being different. You want optimal, you want functional. You want to be functioning so you can be optimal. Tonight we're going to talk about brain and cardiovascular, but not by themselves. In fact, I'm even going to throw in the blood sugar with it. This cannot be a separate issue, but that's the focus. We're going to be focusing on brain and cardiovascular health, but how it's affected and how each of those affects the other. And then we're going to have some answers. And then I've got a surprise for you. Lots of stuff. No, nothing's going to jump out of a box like a bunny or anything, but we're going to have fun. And I'm glad you're here. So, we're going to be connecting the dots. Cardiovascular disease and diabetes and cognitive decline or dementia, and how we as a drugless therapy practitioner, naturopaths, how we need to consider what we're looking at and how we help manage and support those systems. I didn't say cure. I didn't say all those words I'm not supposed to say. We are adjunct therapy, but oftentimes that's all you need. Let's go to the next one. Right now, we are in America an aging population. We are definitely seeing the baby boom come around. All populations that age usually have to address some chronic issues as they age. And we've got a lot of them coming. One of them is dementia, and one of them is cardiovascular, but golly, because it's so tied in, I couldn't leave out dysglycemia. I couldn't do that. Wouldn't be right. Now, we're going to be talking about how to manage it. Lifestyle changes, diets, even some of the other genetic considerations that are linked will be talked about. Let's go on. We're going to talk now about the classic, but this is not just about baby boomers. This is talking to people that are baby boomers, but also those before you are baby boomers, what you need to be watching out for as you begin to become what the age group now of baby boomers who were born 46 to 64. I'm right in the middle of that. And so 2011, we had this raging group of people retiring. By 29, this group of people is going to be 65 at least. That's a lot of people, by the way. Next one. So, when we look at chronic diseases in the United States, let's start there, not by age, but just by what horrible things top the list as killers. Cardiovascular, heart disease, number 1. Cancer, 2. And then the third one's a lie. I'll tell you why in a minute. But it's saying here respiratory. 4 is stroke, which I really would put in the category of 1, wouldn't you? So that even pushes 1 back up higher. And then there's accidents. And then we have dementia or Alzheimer's. Then we have diabetes, influenza, flu, and it goes on down from there. This does not have respect to age, period. It's just total. But the next slide is going to tell you a little bit more accurate. Number 3 is not chronic. Number 3 is not this right here. It's not respiratory. It's preventable medical errors in the hospital. Kills more people than these 7. No wonder people are scared to death to go to the hospital, right? When I have to talk to a dentist or something, I mean, I'm not a dentist, and sometimes I have to go use their technologies to find out what's going on so I can set my therapies up. I don't tell them who I am. I had one of them say, "What have you been looking up on the internet? What are you looking on the internet all? Where'd you get this information?" I said, "Well, I didn't get it off the internet." Then when I walk out, I say, "Well, I was a professor of pre-med and nursing up in Michigan. Just so happened to have a clinic, and I'm a doctor." And they they fall over. So I'm not there to get their prescription. I'm there to get their help in diagnosing. Hey, what's it look like down there? I can't see it. You know, it's kind of hard to see your own back. You can't look in your own ear, right? You can't look down your own throat very easy. Trust me, I've tried looking in the mirror, and you can't do it. And so you let somebody else tell you. Thanks, that's what I wanted to know. I tried to get my wife to do it. She goes, oh, I'm not going, oh, no. She's like, you know, blood drops, and it's all she wrote. I then am picking her up off the floor, yeah. But she's great at the front office. Chronic disease. Cognitive decline has accelerated by 2. Is accelerated by 2. Cardiovascular disease and diabetes. Let me say it one more time in a different way. Dementia, Alzheimer's, is accelerated by cardiovascular health and blood sugars. That is basic. Now, these complicating factors that cause it are obesity, inflammation, we will be talking about, are the very key factors to lifestyle that we'll be talking about. And trust me, I've been an athlete all my life. I had a raging attack of genetic bad genes. I've had 15 of my people die of cancer. I've survived. They didn't. I did alternative. But it didn't leave me without, so to speak, scars. My metabolism is not what it used to be. So now I get to fight, like many, with weight. Let's go to the next one. But in the order, when we start talking about brain health, we got to start first by talking about preventing. You're in here today. Now's the time to start preventing. Current treatment strategies that when you get it are to reduce the symptom, not to get rid of the problem. The best way to treat it, though, in cognitive decline is to, first of all, minimize the risk and get in a preventive mode. That means if you, wherever you're at, whatever level you're at, start now. Primary risk factors for dementia are as you age, not because you are old. It's just the fact that the older you get, the odds are you're going to visit that somewhere along the line, and it's going to be, I left my keys somewhere. You know, it just happens. I call it getting your hard drive overloaded. You get older, you get wiser, you have a lot of information, but you kind of crowd out other things. So we do kind of need to rewire. There's genetics too. If you have a family member that has dementia, anywhere in your family, you need to listen close, because this will be talking to you tonight. The risk factors that are involved must be diagnosed appropriately and treated accordingly to properly help people or patients. And that's what the medical community tries to do, is treat the symptom. Let's go to the next one. So let's get into a little bit about nerve theory. We call it neuron theory. Well, how does it work? What's it doing? Well, in order to survive, a nerve needs 2 things. It needs fuel, and it needs to be activated. You're here tonight. Your nerves are being activated. You're listening, you're engaging, you're not talking, but hopefully you're not asleep, and so you are active. An active mind is a healthy mind. You know, I don't care if it's a crossword puzzle. That's an active mind, okay? You don't have to run 300 miles a year. You just have to have the ability to engage the mind. But it does help to exercise. And when you do exercise, it does something very unique. It fuels the brain. How it fuels the brain is real obvious. When you're out there doing a fast walk, or maybe even a run, you breathe faster. When you breathe faster, what happens? There's more oxygen. As long as you're not burning it up in the muscles, the brain's getting a lot of oxygen. Pretty soon something happens, and your brain begins to secrete these really funky neurons that kind of cause some people to get addicted. But it's a good kind of addiction to exercising. And it's healthy for the brain because the brain is friends with oxygen. So, interruption of either of these two will lead to your nerve death, and then your brain won't function normally. Let's go to the next one. And so, as we continue this theory, what are the known risk factors for the death of a neuron or a brain cell, or any nerve in your body for that fact? It would be cardiovascular disease, blood sugar out of whack, and that means not just diabetes, but low hypoglycemia too. It's not any friend of you either. Your brain has to have sugar. So when you're low, you don't feel right. You get kind of disoriented, just like you do when you have too much. And of course, low exercise. This all lowers fundamentally this thing that has to be delivered to us. When you're an EMT, or if you're an emergency med tech, what's the first thing you check for when there's an accident or somebody's hurt? The air passage. Are they breathing? Number one. Number two, bleeding, which carries all that oxygen. Without that air, you're going to have a death or some neuron loss. Other factors actually do, as we find out later on as you research this, affect us and our ability to have good mental health. And that's your educational level. I don't know why. Maybe it's smarter people do the right things, eat right, maybe they exercise. I don't know what it is, but I think educational levels are extremely important. But I'm not talking as an academic here. I'm talking as a practitioner. It's really good to learn how to take care of your body. And then there's some more. If you want to keep things connecting, you just have to be active, mentally and physically. And it'll work. It will work for you. Let's go to the next one. So, let's start connecting some of these and see how brain health is connected to our heart. Let's continue here. Evidence indicates a strong association between guess what AD is? Guess. Autoimmune, you think that's it? And cardiovascular. Including other things like AFib, thrombotic events, hypertension, hypotension. That's over blood pressure. Hypertension is high blood pressure, which means you can have a stroke. These are the highest killers because they can kill you so fast. The response time in the emergency room is not very big. That's why they're number one. It's not that they're the most deadly from the standpoint that it's just that it does it quicker. Because you can't breathe, that's a pretty fast way to die. Right? Okay, heart failure, high serum markers of inflammation, We're going to talk a little bit about inflammation and how it affects your brain and how it affects cardiovascular, coronary artery disease, low cardiac index, and other things. And this is Alzheimer's disease. All right, next one. So, why does the heart affect our brain? Because it's what fuels the brain. The heart pumps right straight up out of your heart, right into your head. And the most important nutrient, you don't really think of it that way, but it is oxygen. Next one. So the first observation that cardiovascular disease and dementia was seen to have been linked only came in the late 1970s. There's many in this room that have been around for decades before that, and they didn't even know there was a connection. Now, there were some pretty common sense people that probably knew it anyway. You know, those people that said, I'm not going to retire. I'm going to go down to Joe's garage. I'm going to sweep the floors. I don't care if he pays me or not. Or maybe I'm not going to sit down. I'm going to go down and bag peanuts for the local, whatever. Or I'm going to volunteer at the library. I'm going to keep busy. Whatever it is. But the link is called cardiogenic dementia, which is the most ignored part of dementia in the medical community, really. It wasn't until the 90s that CVD and Alzheimer's would actually be linked in the clinic setting. Next one. So, what happened? Well, generally speaking, this relentless chronic hypofusion, and I'm going to talk to you tonight, your take-home word all night tonight that you're going to learn is called hypofusion. Anything that is hypo means low or under normal. So chronic abnormal fusion, whatever that is, we'll learn in a minute, of the brain that's caused by cardiovascular disease accelerates your cognitive decline. So it's not all in the brain. If you have or know someone that has cardiovascular disease of some type, their risk of dementia has increased 70%. That's a big increase, isn't it? Heart health is brain health, but brain health is heart health. Initially, the connection between cardiac diseases or pathologies and cognitive design was made because of a bunch of dementia people in nursing homes and all over the country had these cardiac things going on. They'd be taking their blood pressure and they'd be listening, to their thump, thump, and it'd go thump, 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 or it wouldn't thump. They'd go, whoa. So they put a heart monitor on them, and they began to see a higher amount of dementia associated, or higher amount of normal cardiovascular events in a dementia person. And most people said, oh, it's the brain causing the heart problem. It was the heart problem causing the brain problem. Next one. The main function of the cerebral autoregulating ability is to maintain cerebral perfusion. Let's talk about perfusion one more time. Perfusion is the ability for that blood to rush to the brain, the oxygen it needs and other nutrients. If it's not getting it, there's no perfusion. It's their stupid word. It's kind of like you go into the doctor and you say, I have this pain in my finger. Oh, it hurts so bad. And you give him $100 and then he translates it for you and says, well, that's arthritis. Thanks. I don't need a translator, you don't need a translator. Perfusion is just a big word for not getting enough nutrients and oxygen. Anyway, in the absence of any kind of heart disease, this prevents hypoperfusion from causing problems in the brain. So if you do not have any heart disease, it's likely that you will not have an underfed brain. In the presence of any kind of heart disease, cerebral activity, known as autoregulating, it's sitting there doing things you don't know. You walk up steps, your heart starts pounding faster on its own. And it regulates when you go outside and it's cold. And it does all kinds of things, and you're not telling it to do it. So this autoregulation may be altered. So as this heart that doesn't do its job may be thought of as causing other things to go bad, it's the brain that suffers. Number one, this big, huge glob of neurons sitting above your neck is the number one target of cardiovascular disease. So, cerebral autoregulation, by the way, the ability to have a normal brain begins to fade with aging not because you're older, because once it's ignored, and if the longer it's ignored, the higher your risk is of both heart disease and dementia. So, if we have a reduction of cerebral activity, and there is a hypo or under supply of nutrients to the brain because of the heart, we've got a problem. The brain's underfed or hypoperfusion is going to affect the older brain, mainly because growth factors, growth hormones are lower in older people, and they do not repair as quickly. Doesn't mean that younger people don't have as much damage if they have exactly the same problem. But the dysfunction's increased, and we'll not get into any of the technical stuff, but let's go to the next one. Let's get into which process of this cardio or heart dysfunction is contributing to decline, and how is it? Let's go ahead and do the next one. You're going to see, here's the heart, all kinds of valves. There's a valve, there's a valve, there's a valve, there's a valve. And there's all these arteries coming in, the bottom going out the top, but cardiovascular risk factors that can cause cognitive loss or undersupply of nutrients to the brain. It can be aortic stiffening, they get hard. Or you might have hypotension, under or low blood pressure. If you have low blood pressure, many people will be sitting down and they'll stand up and they'll go, whoa, and they might even pass out. Or they'll get real dizzy. They don't have enough blood pressure. You're going to learn tonight how older people and what's called mild high blood pressure can benefit. I'm going to tell you that in a minute. Oh my gosh, you're crazy. Anyway, there's heart failure, there's hypoxia, that's not getting enough air. There's hypertension. Now, hypertension is different than under or low blood pressure. Low blood pressure won't give you a stroke. That's pretty hard to get, over as a stroke. It can be deadly. It can cause you nerve damage. It's pretty fast. But hypo is more chronic. Every day, not getting enough oxygen. It's a slow eating away or eroding of that shoreline by the waves. And it's slow eating And so hypo, although just as damaging, is not as quick. So we have arterial fibrillations where they don't beat properly, not in sync. Coronary artery disease, they call it. Many other things in here that can cause heart problems. But we're going to talk all about how we can keep that from happening next one. So we're going to talk first about taking care of your heart and what it is they're doing when they check your heart for a bunch of things. Now, one of them is an echocardiogram, and that's the same one they use to find out if you're having a boy or a girl, you know. And they put it on your heart, and there's these boom, 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 going to town, and you're just laying there, and they're looking on the screen. And they can measure from that how much blood comes into your heart and how much blood goes out of the heart. It doesn't completely empty with that heartbeat. There's still some in there. So how much is in there? Well, a healthy heart has about half to 70% of it pushed out. And you can get that. So 55 to 70% of it ejectioned means that how much blood is sent out of the heart. That's called the ejection rate. That's healthy. And I've had people who have had part of their heart die off and they had 15%. Anything less than 35%, they're at a big risk. You don't hear too many at 15. He didn't want anybody to work with him. And I've worked with the Heart Institute out of Tulsa, their support group. But we got him back up to normal. And you go, how do you do that? Well, we grew new tissue. Oh, the heart can't do that. Oh, yeah? Well, that's what the medical community says. We don't have anything for viruses. Well, then don't go to the medical community. The problem is we can do things. Anyway, we can improve low ejection rates. If you get below 55%, you're starting to get below normal. And it's real easy to do. You just have to have a good technician. Next one. Low ejection fraction or output, as it's called, is how we measure how much blood exits the heart in liters per minute. We already talked about, but the number is 4 to 8 liters per minute, averaging about 5.5. Next one. Low ejection rates and low cardiac output in elderly people with heart failure is associated with specific problems like attention deficits, the ability to discriminate, clearly think, know where they're at. You want to turn them around, check their heart. Additionally, low cardiac output has been found to be associated with this thing called executive function, making decisions, good ones. If they're starting to you see somebody and they're not making sense, it's a good sign. Yeah, it's here, but this needs to be checked. If patients over 63, when they fall below 30%, memory is affected compared to younger people. And that's because younger people still have brain cells being made easier. Now, this suggests the elderly mind or brain is more susceptible than the younger because of just one easy thing. We can't repair as fast in the aging population as a 30-year-old. Next. But AFib, as they call it, affects about 2.6 million people. And as many as 12 million people are going to be having this condition by 2050. You know who that is? Smack dab in the middle of the baby boom, right? AFib, the rate of this ventricle contraction is less than the atrial contraction. This is what that is. When one pumps in, there's two chambers in the heart. They don't pump the same. They're not in sync. They need to be, one can't be real weak and one of them normal. It won't work. That's AFib. All right, let's keep going. We have 60 some odd slides tonight, so well, we're halfway there, huh? And we got more to do. Now, there's been a recent study of 37,000 people with an average age of 60 that had AFib. They showed significant increase in their ability to think, their cognitive impairment incidents, and they did it over a 5-year follow-up period. Let me follow up with this. This is getting confusing. And let's go to the next one because I want to hurry and get there. Hypertension, as well as hypo, that's under low blood pressure. Hypertension is a known risk factor. You already know that. It can cause a stroke. Now, why is stroke and high blood pressure so important? Because the response window of safety is real short. But we are now finding, you're going to die when you hear, no, you won't die. You're going to be surprised that if you're over 65 and you have mild hypertension, you may be better off not going on high blood pressure medicine because it may hurt you. Your body, as you age, goes into more blood pressure mildly for a reason. Your body responds absolutely perfectly to inside and outside stimulation, to inside things, to outside environmental things that comes to the body. Whatever your body's doing, it's the best answer. It may not be fun, it may hurt, but guess what? Probably the options of the other things it could do are worse. So if you're having hypertension and you're over 65 and it's just mild, what I'm saying is lowering that blood pressure is now being found to be worse. Got to tell you, Susan and I went to New York to study and went to a seminar to one of the country's absolute gurus on interpreting blood panel and values. I mean, he's just, we call him Dr. A. He comes from an Italian family. All eight of these boys are all brothers. They're all doctors. And it was holiday time, and it was his turn to take their mother shopping in New York. He says, so we went shopping. Well, before they went shopping, though, she had a physical, and they found out that Mom's cholesterol was 800. Woo! This was the first time that caused all 8 doctors to get on a conference call together in their entire lives at the same time. What are we going to do about Mom? Guess what they decided? Well, Dr. A was the guy to go to. This was his kind of specialty. Here's what he said. He says, I just took Mom shopping. We went 12 blocks. Do you know how many blocks, how long 12 blocks are in the city? It's a mile. And that doesn't sound like much. But we're talking about going in every store, up every flight of stairs and all these elevators, up and down in Macy's, up and down in Saks, up and down. I mean, so we've got a mile this way and we have a mile here and a mile here. You know what I'm saying? And when he was done with her, they were a mile and he's carrying all these boxes. She's carrying too, and he's got all these bags and boxes. And he's out there at the side. Are we done, Mom? Are we done? She says, yep, we're done. And so he walks over to the side and he raises, he says, what are you doing? He says, I'm getting this a cab. We're a mile. She says, you put your hand down. We walked here. We can walk back. You know what they decided? they're not going to do anything to her. If she can do that, she's as healthy as that. I don't know, she's in her late 80s. We're not going to touch her. Maybe it's just best to leave her alone. I think there's some antecedent wisdom in a lot of that kind of thing that we don't read in research panels and papers today on PubMed. HTN, hypertension, is a common condition. It's most common in every general practice. Now, I, as a drugless practitioner, would be kind of compared to a general family practitioner. I see babies do well baby stuff to elder care. And that is probably true. Now, when we're talking about cardiovascular stuff, I also have to be aware how it's affecting their brain. We cannot separate these things. So, let's talk about the blood pressure stuff. 120 over 180. Do you think that's normal? Well, I guess you could say that. But I have a cousin. He set running records in high school. He set running records out of high school. He has set running records in the Masters of something. I mean, he's older than I am, and he's still running 10 miles a day. Goes out to a lake and runs 28 miles around it to see how much he's lost. The last time he ran at about 2 minutes less, but he was mad because his leg cramped up on him. And I'm going, and you ought to see him. He's not just a runner. He does weight training. He's one of these guys that should have that big red S on his chest, dark hair, blue eyes. He's a guy's guy, and of course the women, I don't even exist when I was around him, you know. The problem, though, is this. We're not all genetically predisposed to be able to do that. But we can get there. But you know what his blood pressure is? He has to run 2 miles before the heartbeats get over 60. It's like, this guy doesn't, I mean, when he went to give blood, they said, oh, we can't take your blood. He said, wow, well, your blood pressure is too low and your heartbeat's like 52. And he said, don't worry about that. He gave double for my dad's heart surgery of blood. He's given blood all of his life. He has one of those little cards, you know. And I'm going, man, I think I'll take some of his blood whether I need it or not, you know. There's got to be something in it, you know. Hypertension, mild high blood pressure, is right here, stage 1. Pre-blood pressure, right here is what they say. See this right here? 159 over, say, 90 to 99. If you're over 65, next slide. If you're over 65, this right here, maybe when that doctor wants to give you blood pressure medicine, but if you go to this website, the NNT.com, you will find lots of research that if you're over 65, it may not be a good idea to take high blood pressure medicine if you are in this category. I'm here to shatter and challenge. I'm here just to give you the facts, because practice does not keep up with research. So we need to get them to catch up. Do you know why we don't have other labs around here? I've tried to get one. Ask Jake. He's heard me say it umpteen jillion times over the last year. I have frustrated him. I frustrated me trying to get a lab started here that we can get people in without having... If you knew what the doctors make off a lab when they send you in, you'd die. It's more than your office visit. I don't think that's ethical, do you? Hypertension appears to be a problem when it's long-standing and chronic, meaning having started before you were 65, basically. Middle age, stress job, peak of your career maybe, under a lot of pressure. What's going on? It's not heart. It's adrenal stress. What do the adrenals do, Jake, when they get stressed? Stress hormones. And they cause inflammation. Inflammation causes those artery walls to swell up and not be as big, and then therefore less blood. So it damages the brain and the endothelium, or the brain's tissue. It even damages smooth muscles in the heart that control the blood to the brain. And so we result in hypoperfusion, underfed brain, because of stress. In the 50-year-old man that will now be not paying attention to it and will chronically have this hypertension because he's in a stress job. How many of you all heard these people go, I had this heart attack, and so two times a day I shut myself in a room and I just kind of focus, I meditate, and I try and bring my self down to ground. Can you imagine being a stockbroker? I mean, it's rigged anyway, right? So you're fighting the system. So here's another one I want you to go to. You can get apps and put them on your phones. You can come to my office and we can track you. We can put little things on it, and I can get monitors wherever you're at. If you let me turn on your phone and get your passcode, and I'll say, you'll hear the phone ring, and it'll go, it's me, it's Doc. What's going on? What do you mean? Well, you're kind of stressed, aren't you? I'm in a meeting. Well, you're going to have a stroke. I don't want to, it can happen. I mean, it's happening. I want you to go to heartmath.com. Heartmath.com. Wonderful. You don't have to buy a thing. It will teach you a lot of stuff. They'll bug you to death if you sign up for their emails, but they do have really good exercises to help you bring that stress down. What they do has a lot to do with what Jake's real familiar with, and that's heart variability, and how you can use heart variability to link how your nervous system and your entire body is responding. You want the mind, the body, and the nervous system, you want this all in sync, working not against each other, but in sync. Heart Math can help you do that. All right. So there's some evidence that high blood pressure has direct effects on dementia because it is a dysfunction of the blood system. And there are these things called neuron tangles, I won't give the big word, and plaque in the brain that's caused by high blood pressure that low blood pressure does not do. One of these, this one, is in the nerve and it gets damaged. The other one, this one here, plaque, is outside the nerve and it causes damage. So inside and outside the nerve, problems begin to develop with hypertension that do not occur in normal and hypo. Next one. There's some controversy over whether elderly people with mild, that's stage 1 to moderate, hypertension should be treated aggressively with anti-high blood pressure meds because it may lead to unregulated hypotension. In other words, just because you brought it down, it may not be right for them. I have people like my cousin. Jake would love to run with him. I'd love to see that happen. I mean, I'd just love to see it. They'd be probably best buddies when they got done. But I'm not going to be able to keep up. Do you think he has normal blood pressure? Do you think he has normal heartbeats? No. If you weren't looking at him and knew what he was like, or what he could do, and you just took that, you'd go, oh, man, we got to work on this person. We're going to have to give him this and have him get, right? See, it's not always the right answer. Now we're finding it's not the right answer for over 65. Okay. Next. Hypotension is actually real common over 65. It really is. I would have to say this has got to be the most chronic condition causing dementia in elderly people. Because hypertension, high blood pressure, usually results in a stroke or something instantaneous. This slow eroding of the mind with low blood pressure sneaks up on people. And it can be a result of bleeding, some kind of medications, dehydration. Now, I can do specific gravity tests at the office with a stick and urine, and I'll say, okay, you need to drink more water. I mean, it's just real common in the elderly. They just don't drink enough water. Got to make it fun for them. No, you don't put lemonade in it, Kool-Aid in it. No, no. Don't give them red dye number 5 and horse hooves and sugar. Don't do that. Okay? There's also genetics playing, and are of course, there any heart diseases. Next. Yeah. Low dystolic. There's systolic and dystolic. Okay, you remember there's this number on the top and the number on the bottom? It's kind of like when I tell people in class when I'm teaching them about parasympathetic and sympathetic nervous systems. There's only two of these things, all right? And I'll just say, sympathetic has an S. That stands for stress. And when they say, well, what's the other one mean? I'm going, you're not going to make it. If you don't know what the other one means, it means no stress, come on. So anyway, here we go. D and S. Dystolic starts with a D, and that means the number is down. So the D number is the one on the bottom. Yes, the other one has to go on the top. So, dystolic is a little number. So if we have low bottom numbers, we're at risk. If that number is like 70, and you're not my cousin, who's, oh, I got to tell you, what did he do? What did he do for, you know what he did? He went to work for the post office. They wanted to give him a truck. He said, are you crazy? I don't want a truck. They said, yes, you are. You're going to have a truck. You know what he did with the truck? He parked it, put the bag on his shoulder, and walked. And he went right up to everybody's door. There's a mailbox out there at the street. Man, they loved the guy. And then when he got home, he'd do like another 5 miles or something. You just wouldn't believe it. Genetics plays a lot, but what I'm saying is, if you aren't him or exercising and obtained a strong beat at a low resting point for the heart, then there's something going to be going into the brain without enough nutrients called blood. This resulting underperfusion or under nutrient delivery to the brain from low blood pressure is linked to dementia directly. Guess what? They're on the verge of saying it's the number one cause. Isn't that amazing? I mean, when they say that, it's important. Cardiovascular health. Next. Oh, you got it. Coronary artery disease. A normal artery swells up. Right here, we can have that inflame from cortisol, inflammatory secretions out of the adrenal glands from stress. It's not plaque. It doesn't coat the wall. the wall gets too thick and narrows the pipe down. There's a surgeon that did 6,000 open heart surgeries that wrote a book, and he said the number one reason for them being on his table was not plaque, it was inflammation. I think he knows what he's talking about. Boy, did he come. You know why? They've got to sell all that stuff, you know. Your cholesterol's blah, we got to give you this, we got to give you this. You don't do that. Okay, next. Vessels that get narrowed can be also narrowed with plaque when it builds up inside the artery. So it's not like there isn't plaque. But how much of the time is it plaque? 8 out of 10, it's inflammation. 2 out of 10, it's that. Plaque can rupture, causing platelet aggregation, and you get a thrombosis. There are some tendencies for people to build up plaque, oftentimes related to the same kind of proclivity some people have to building plaque on their teeth. Have you ever heard of some people that the dentist go, man, you got to come in more than every 6 months. Your plaque, we've got to clean it. If you're one of those, you need to be taking care of the arteries too. And we can do that. So that's important to know. Plaque can rupture and cause this thrombosis. And of course, that further narrows the vessel, causing a heart attack right here. But if it's in a brain and it gets stuck up there and blocks something, it's a stroke. And nerve cells die because they can't get oxygen. Now, a nerve cell has these little fingers on it. They're called dendrites. You can cut one of those off and it'll still work. But if you cut right across the middle of the cell, it's dead. So you can grow new dendrites and nerve cells, or you can continue to have connectivity from the nerve. But if it gets cut down the middle, it's gone. There's one nerve cell in the body that regenerates. They're looking into using it to repair paraplegics, quadriplegics, and that nerve happens to be in your nose. Because let's say this is a nerve cell. That nerve cell comes through the tissue, comes through the tissue of the inside of the nose and sticks out, not way out like this, but level with the tissue inside the nose. Literally, this nerve is exposed to the air. Why? Because it's not like looking at something. If I look at that light out there, it's not touching me, is it? I'm just seeing the light reflect off. But when you smell something, that's different. It doesn't smell something over there. A particulate has to float in the air and touch this nerve cell. So that when you go over to roadkill, this is when everybody goes, ooh, get ready. And you go, oh, you know, it's, oh, or you drove over that skunk. Do you know what that smell was? That's particulates off a dead animal floating in the air, touching, physically touching your nose. Woo! Wouldn't you die if you were a nose nerve? I mean, they get worn out. That's the 10th skunk I've had to smell. I've had it. Check out. No, it will grow back because it oxidizes. Oxygen burns them. So it's replaced. Now you've got a lot of nerve cells on as far as the square footage, but a dog has a lot more. That's why he goes up to the fire hydrant when he's busy. If he's walking, you got to give him a break. He's going, has Pinky been here today? Nope. Where's Pinky? Go, oh, let's try this fire hydrant. Their nose tells them what their community's doing. I don't think I want to be a dog. Well, anyway, heart failure, common complication from cardiovascular diseases, is heart failure. Heart failure occurs when the heart is no longer able to pump enough blood to meet the demands of the body. The very first thing usually that goes is your brain. And as you begin to fade off under anesthesia or whatever, lack of oxygen, you start seeing it slowly get dark, but you can still hear. Visual goes before the hearing. I have a cranky gallbladder, and I was going, uh-oh, I'm having an attack. And I went in the bathroom because I knew I better get in there. And I'm sitting down, and I'm sweating blood. My heart's beating, and I'm going, oh, no, don't tell me. I am not getting my gallbladder out today. Don't do it. And my wife's going, are you okay? I couldn't respond. I could hear her. I couldn't see her. And the next thing that I know, I'm waking up, but I'm no longer sitting. The things that we have to endure don't have to be endured, and especially when it comes to cardiovascular health. As I just told you, a gallbladder caused me to have a cardiovascular event, kind of passing out. Why? Because it shunts blood to different areas to do something, to protect you. Just don't let your head hit the bed on the bedpost on the way down. Symptoms include weakness, tissue anemia, shortness of breath, and they used to call heart problems dropsy. Do you know that? Because people felt real heavy. Let's go on. Where are we at? Oh my gosh. All right. Brain underfed is a common outcome of heart failure. Heart failure is the most common reason for hospitalization of elderly, which worsens the ability to think and have a cognitive ability. Then there's regions of the brain that are associated with memory and other visuospatial orientations, particularly that are affected by heart failure. And as I was beginning to tell you, different parts of your body are affected at different levels. Certain things are more sensitive. Your visual is one of them. Impairment in these functions is often a sign of dementia developing. So just because you haven't manifest or don't think somebody is manifesting a cognitive impairment, if they have a heart issue, they need to be extremely aware it could end up causing them to have dementia. Cholesterol only becomes important if there are three other things that are messed up, or one of the three things. If you do not have inflammation, if you're glycating, or if you do not have hypo or hyper blood sugar, in other words, if you don't have diabetes, and if you're not hypoglycemic, and if you are not in your oxidating okay, if you still have all this going okay, and you can test every one of these, and you have a cholesterol issue, now the prognosis is no. You shouldn't be on cholesterol medicine at all. Well, you know my answer for it, even if you have those. But the bottom line is cholesterol only becomes important if one of these others are involved. For example, if you have high blood pressure, well, yeah, you might want to, take it down. It's not something you want to play with, but you fix it. There's lots of other ways to adjunctly work at it, and we're going to go over those in a minute. Go back to that last paragraph. In patients with established cardiovascular disease or diabetes, it can be assumed that all of those processes is a problem. And therefore, their cholesterol is too. In other words, we're not one thing. We're not just, our body's connected to other parts. So if you go to an ENT guy and you says, oh, you just have a little of this, that might affect something else too. There might be some other part of the body causing the problem. Okay, now. Dyslipidemia, that was almost going to be my word for today, I couldn't say. Dyslipidemia, see, I'm trying to do it again. By the way, that's fat tissue. Cardiovascular disease and your ability to think. To get an accurate picture of a person's risk with standard lipid panels, well, it's just not enough. You just cannot do, it's not enough to say, lipid panels are going to tell me if I'm healthy. You must assess something called the particle number in the cholesterol, which is in addition to the inflammatory markers and the insulin levels, the A1Cs, and your genetic predispositions. Go ahead and go to the next one. What in the world are particle numbers? Cholesterol is made up of LDL particles. LDL particles can be large, they can be small, and the size of these particles is really more important than the number. And you can get your particle size measured. Spectra Labs, write it down. Spectra Labs is a place you can get particles measured. If you have a lot of, say, cholesterol, but you have one big particle, you're at low risk. If you still have moderate amounts of cholesterol, but you have two big particles, you're still at low risk over here. It's when you have high amounts in small sizes and several numbers of them is when you get at high risk. What? Yeah, there's more than just cholesterol. It has to do with particle sizes. Interesting, isn't it? So just because you get a bad number here doesn't mean you're over here. Okay, next. When you have bad blood sugars and you have fat problems, poor lipid profiles, they seem to impact us. They really do. And your cholesterol levels will play a role in there. But this all plays together. One's 10%, another one's 15%, and it all starts piling up. Go to the next one. So, what do we do? What's dysglycemia? How does diabetes play in dementia? We haven't been talking about it yet. Go ahead. Diabetes is a risk factor for Alzheimer's and dementia. Some references are referring to Alzheimer's as type 3 diabetes because it's so similar biochemically. Type 3 diabetes is Alzheimer's? Wow. So preventing is the best defense, but if it's not a choice, controlling is there and it can be done. Next. Metabolic syndrome, which has to do with blood sugars. A syndrome that is having trouble balancing insulin and blood sugar is associated with the development of dementia. Metabolic syndrome raises the risk also of Alzheimer's. Man, 70%. Blood sugars. Other factors complicate this, and that's inflammation. It's measured by interleukin 6 and CRP, and you're probably going to get CRP in a blood panel. Doubt very seriously if you'll get the IL-6. But we do interleukin therapy over at my clinic. It used to cost $15,000 a month, but we get it out of Italy for 100 a month. And you put it under your tongue, you don't get shots. It's not some big fancy deal. And we use IL-10 as the downgrading interleukin to IL-6 to cause inflammatory markers to go down. But diabetes is common in Alzheimer's. There's abnormal protein processing going on. When that's occurring, you're going to have a problem. Abnormalities in insulin signaling is going on, dysregulated glucose metabolism, oxidative stress, advanced or the formation of advanced glycogen and end products from it, the activation of inflammatory pathways. 80% of the patients with dementia exhibit either impairments in their glucose or frank glucose or frank diabetes. You know what frank diabetes is? Pre-diabetes. Pre-diabetics can start having these problems, and they're not even diabetic. Next. Each affects the other. Dementia affects cardiovascular. Cardiovascular affects dementia. Blood sugars, are you all in one little package or not? Are you a whole person? Yes. Next. Reducing cardiovascular disease, reducing diabetes, and will lower the risk of cognitive decline. And for sake of time, we'll go to the next one. Let's talk about answers to cardiovascular right now. Here we go. Cardiovascular disease. You want some omega-3 fatty acids because this reduces inflammation, helps with triglycerides, and it does many, many good things. 3 capsules twice a day. In other words, you want a dose of about 10 to 15 grams a day, spread out over the day. This does not increase bleeding. Don't let anybody tell you that. Next. I've got to tell you, this is undersold, so to speak. This guy here does a lot of heavy lifting in this category. It's great. Niacin. Do not get nicotinic acid. Okay, niacin. It reduces LDL particle numbers. Remember, if you have a lot of particle numbers, they're more risk. It reduces your low density lipids. In other words, it's going to lower your triglyceride and it's going to give you better health. How much do you want of niacin? This is great stuff. You want this flush feeling. Do not get scared if it happens to you. Don't get scared. It's like, oh boy, I can think clear now. 300 to 3,000 milligrams a day, and you take it before bedtime. It's not a morning thing. It's a bedtime thing. Red yeast rice does similar things. It's great stuff. And again, 2,400 milligrams. 2,400 milligrams. Yeah, that's a lot. It's like eating it. But that's what you want, and you take it also before bedtime. Blood cells are flat like pancakes, and they can pile up like chips on a table, and that's stickiness. You don't want that to happen. You want them to kind of bang into each other, but you don't want them to stick together. Well, red yeast rice will help with that. That does not thin the blood, it keeps it from sticking. 2 different things. Next. You may not have heard about this. Pantethine is a LDL lowering, again, and lowers your triglycerides. You want 400 milligrams twice a day. Do it with food. Pantethine. May not have heard of that. Next. Everybody ready? Now, you've got a sheet of paper on your table, and the reason we're going to get into that real quick, I'm not going to talk about it, it's just that plant sterols reduce a lot of the problems you can have with cholesterol. And so you want at least 400 milligrams twice a day with meals. And I have also given you a list of plants that are high in sterols, so you can eat your way to health. All right. How about the next one? EGCG. Green tea, if you want to know what that is, that's right here. If you want to say it for me, have at it. Tonight's probably not my night to say it. I have trouble with the EGCG. See what I'm seeing? Okay, anyway, it reduces the LDL, anti-inflammatory, anti-thrombogenic. It produces or gives you a potentially better absorption in your intestinal tract and manages the cholesterol there a lot better. 300 milligrams twice a day. There are some that are called 200 milligrams a lot of times. And you could do 400 if you wanted. Okay, next. Now, let's talk about how do we reduce hypertension. Whoa, this is a big one. We're not doing this as a prescription to a disease. I'll just tell you that right now. With that caveat said, let's go on here. Number one thing to lower your high blood pressure is lose weight. And this is really hard for older people that have inflammation. Bad knees, can't walk. It's tough. That's why I always recommend, and I wished we had an indoor all around your pool here. Oh, well, see what I know. Because we need to take that impact off joints and still get the exercise. And if you can do that, guess what's going to happen? Your blood pressure is going to go down. So exercise. Some of these aerobic exercises can reduce the systolic. That's not the D, so it's the one on top. 4 to 9. The bottom number, right here, or the top number can be reduced by this as much as 20. Let's go to the next one. Another thing you'll want is you always want more potassium than you are taking salt. Always, always, always. More than likely, if I were to test you all, every one of you would be low in potassium. 2,400 milligrams a day. I get it in powder form. It's the best way to take it. Yes, it tastes nasty, so don't make the glass very big water. I mean, this much water, and then have a big glass of water so that you don't suffer through the icky tasting potassium. It's not that bad, but it's not good. I take it, and then you chase it down with good old regular clear tasting good water. CoQ10. Massive amounts of CoQ10 helped to repair that man's heart, gave him a new tissue. His ejection rate went from 15 to 70. He's like a kid. Taking CoQ10, 100 to 120 lowers it. Here's one thing you must understand, though, with this. You must, if you wanted to get serious about this, you must get emulsified CoQ10. If you're going to do this, do it right. The form the CoQ10 comes in, if you want to go with the Cadillac because you deserve it, get emulsified CoQ10. And he has it in the refrigerator, right?
Yeah, we have a shelf stable.
There you go. Emulsified. Shelf stable. It's the package, right, that keeps it stable. Okay, next. All right, prevention, supplementation, diabetes, next. Let's remember your vitamin C is 1,000. You don't need a lot for diabetes anyway. 2 tablets twice a day. That equals what? 4,000 a day. Spread out over the day. Vitamin E, usually those are about 400 milligrams. I don't care really that if it says to take 2 on the bottle, you've got to take 2. If it says take 3, take 3. But usually I say a normal size vitamin E capsules, 2 of them twice a day. Next. Magnesium cannot be. Magnesium's overlooked for blood sugars. Well, some of the symptoms people have that they get magnesium for is constipation, muscle cramps, but if you're having those, you might be having unknown blood sugar issues. We're not separating those two out. We're all one whole body functioning. If you're symptomatic with magnesium, constipation, and muscle cramps, you might be having blood sugars and trouble and not know it. So magnesium is really great. 100 milligrams of magnesium. Not 100 milligrams, including the carrier. You have to get pure magnesium, period. 100 milligrams. 2 of them twice a day, so that's what? 400. Next. Chromium in doses 200 to 1,000 microgram. Decrease the blood glucose fasting insulin. And you'll want 200 micrograms in that tablet and take 2 tablets twice a day. And guess what? All that's right here. It's right over here. Okay. We do have some placebo studies. Now, I do like lipoic acid, but as much as I like it, it's the other things that we've already talked about blood sugars that are better. But you'll want to have this 100 milligrams, maybe 3 of them a day. But I do 600 a day, and it's fine. Here's some readings. Functional neurology for practitioners. Lay that up for a little bit in case some of you might want to write this down. Some more reading. Go back to the last slide and then come back to this one. Go to the end slide, I'm sorry. There we go. I want to thank you for coming. I'm going to have him put the other one back up. Thanks for coming tonight. I hope you got something out of it, but we have something to give you. This is a brain quiz. Ooh. You can take this brain quiz home. We're not going to do it here, so you won't have to. I'd probably flunk it too. Okay? No, there's no flunking to it. There are 4 main hormones that the brain secretes. If you're in, say, chronic pain, and you're dealing with arthritis pain or something, you're going to be using something the brain makes to make you feel normal and happy to mediate the pain or to control that pain so it won't be spent making you happy. It's called GABA. If you run out of GABA, you get depressed. You get depressed because you're using GABA to fight the pain. And you're not depressed because you have achy joints and you're sad about that. It's that it was used to do something else. So there's 2 sections to this quiz. One is, what kind of person are you? Are you the type that wants to, are you the kind of personality that needs a lot of GABA, serotonin, acetylcholine? There's 4, okay? There's 4 different kinds. What's your personality demand the most of? You're going to find out what kind you are. Then the second quiz is going to tell you if you have symptoms of one being short. And it will tell you how to interpret the score to know if you need to maybe pick up some GABA or acetylcholine or whatever, okay? Right here in the health food store. There was a lady here having all kinds of pain in her back. I said, oh, you got to have some GABA. She said, the doctor already gave me a prescription for it. I'm going, oh. Well, maybe it's free, but it's not the right form. I just cringe at that kind of thing. The forms you can get here are better, okay? It's been my pleasure being with you. I hope you have fun with your brain quiz, and if you have any questions, you can call us at the office. I don't know, is our phone number on there? Yeah. Thanks so much. I'm glad you came out tonight, and we'll have the video up on YouTube. We'll link over to it from my website, this site, and you'll go over it again. Thank you very much.
Thank you.